Thank you. Good afternoon. I realize we're the only thing between us and lunch, so that's our motivation to speak quickly. Right?
Absolutely. Good thing lunch isn't out yet, so.
And I can't wait to see my caricature. So people here have been talking about their early dental experiences, so I'll quickly share mine. I was born and raised in Jersey City, New Jersey, in a relatively underserved community with a family of 5 children. My mother was very good about taking us to the dentist, and she would pack us all up in the station wagon and take us to the New Jersey Dental School. And that's where we got our dental care. So at an early age, I was the beneficiary of dental school care as a safety net provider. And maybe that's what ultimately brought me to a career in academic dentistry. But I was one of those kids that belonged to the Career of the Month Club, didn't quite know what I wanted to do when I grew up, but I knew that I was good in math and science and thought that medical school was maybe too much of a commitment and ended up in dental school. The joke was on me because I spent 6 years in postdoctoral training after I went to dental school with an emphasis in dental public health, residency, hospital residency, and geriatric dentistry training. And that's what brought me to my academic career at the University of Florida, where I served on the faculty and then most recently as dean for 10 years, and then decided it was time for a career change. So I think part of our discussion today is about career changes.
Absolutely.
For the past 3 years, I've been at Dentsply Sirona, which is a dental supply manufacturing company based in York, Pennsylvania, so just down the road, and I'm their chief clinical officer.
So what made you make that decision to change from academics into a different area?
So we talked a little bit today about listening, and I think it's important in our lives to listen to ourselves and maybe what motivates us and what keeps us excited about our professional and personal lives. And I really thoroughly enjoyed my time in academics, but I was also looking for a different way to stay active in my profession, perhaps serve the needs of a public in a different way, and pursue a new opportunity. So it was very difficult to hang up your academic regalia and move on to something new, but it was also a really exciting and challenging opportunity.
So you mentioned the difficulty. So what would you say was the biggest challenge or the change in mindset that you needed to go through to make that adjustment?
Well, I think being open-minded, being courageous, being willing maybe later in life to say, okay, it's time to take on a new opportunity.
You're not that much later in life.
I know, but on the positive side, I said, okay, I've been a dentist for 30 years. This is my time to try something new. So I had been a dentist for 30 years. I had lots of opportunities in my professional life. But I thought, okay, let's give this a try. I would say it was difficult moving to Pennsylvania. I was used to a warm climate. You know, you definitely fracture your social support networks when you move to a new community, but yet I thought it was fun to challenge myself to do something new and different.
So how do you think that the workforce needs to change their thinking in order to set us up for a future
So we were talking earlier about all the changes in dental care, healthcare delivery, value-based bundling, changes in reimbursement mechanisms. There are many, many, many things that will change the way we practice dentistry in the future. Not to mention new materials, methods, technologies, emphasis on efficiencies. So there are many, many forces for change in the dental profession. I would say deans today have the challenge in their admissions committee and faculty of selecting students who are willing, open-minded, courageous, flexible, and ready to take on those challenges, recognizing the broader picture in healthcare and the different ways they can serve as dental professionals. I mean, when I joined dental school, I think the typical picture or box you were put in is to be a private practice dentist, typically in the suburbs, doing high-quality individual patient care. I think today the real challenge is how you look at the bigger picture, how you look at the needs of communities, and how you as a health professional and leader can make a difference, not just for and with the individual patient, but in a broader sense in your local, state, or national communities.
And are those the same, so you talk about the mind shifts that we need for the dentist. Is it the same, do you think, in all levels of oral health care delivery?
Absolutely. I mean, I think of, one thing I love about Pennsylvania is the public health hygienist and your ability to to extend the classic role of the hygienist into meeting the community needs. That's a wonderful thing in this state. But you need people who are willing to take that challenge, who are open-minded about the impact they can make in their communities and are willing to serve in that capacity. So absolutely, I think we need those qualities and personal qualities in the entire dental care team, and the willingness to break down silos and work across the health professions in order to have impact either on the patient or the community.
So there's silos in healthcare? Really?
Imagine that.
Imagine that. So the million-dollar question, all right? So what is the biggest mindset change that needs to occur to maximize human capital in oral health care delivery?
I think being open-minded, being creative, working across silos, collaborating, really creating models of healthcare delivery that are perhaps outside the box, and having the courage to really test those and then broadly implement them in a way that impacts the impact and value of oral health care. And then oral health professionals need to have the courage to be at the big kids table, be at the grown-up table, and policy discussions, in working with fellow health professionals, so that oral health is recognized for its importance in terms of being a critical part of our overall health and well-being.
If we were going to embark on a public health campaign, what would it look like for oral health care?
Well, I mean, I think several of us in the room are involved in several of these already. I mean, I had a discussion with colleagues yesterday who didn't know that there's not a dental benefit in Medicare, for example. That's one example of several campaigns that we could engage in that, requires oral health professionals to be at the table, helping to direct policy and making a policy difference. That's one example. There's many of you in this room are engaged in important oral health campaigns. And I think it's coalitions like this that'll make things like that happen.
And what would be your advice to the group here as we wrap up on acknowledging, accepting, and dealing with change?
Just have fun with it. I mean, I think there's lots of challenges and lots of opportunities out there, and I think you have to put your fears aside. You have to put your traditions and your habits aside, and you have to be willing to jump out there and try new things. And I think there's a lot of fun to be had along the way as well, in terms of deepening meaningful relationships with colleagues that perhaps you wouldn't necessarily collaborate or work with. And I'd say just go for it and have fun, and our time's
I'm
up.
a firm believer in have fun. All right, Terry, thank you so much. We appreciate it. I'll turn things over to Eve.